Hello, I'm Ms. Park, and I will be one of your clinical instructors this semester. I'm going to be reviewing the clinical guidelines, the simulation experiences, and the evaluation process today. Before continuing with this video, I do ask that you print out the handouts under Module 1 in the Canvas shell under the clinical course. That way you can add notes as you wish for a reference throughout this presentation, and I recommend creating a folder or a binder to help keep you organized for all of your clinicals. I want to begin by discussing the purpose of clinicals. The purpose of these clinicals and the evaluations are to allow students time to sharpen and practice their skills. These clinicals will also present situations for the student to apply learned theories and evidence-based research to real-life situations with patients. These situations will also allow the student to utilize critical thinking skills along with problem-solving skills with patients. The objectives for this clinical course include the following: demonstrate skill competency, analyze patient results, interpret patient results for identifying the best nursing interventions, develop effective and therapeutic communication skills with patients as well as healthcare professionals, and model professional behavior. I want to discuss student guidelines and conduct. These will apply to simulation clinicals as well as hospital setting clinicals. Students will dress in professional dress as mandated in the student handbook. This includes your scrubs, your lab coat, and shoes. School name badges are required. Students must be prepared. This includes having all of your equipment, such as your stethoscope, your pen light, your paperwork and forms, as well as your reference text for filling out your paperwork. Students will display professionalism when interacting with peers, faculty, and clinical site staff. Now we will discuss clinical instructor and evaluator role. My goal is to provide a supportive learning environment as well as the other instructors in this program. With each clinical experience, I want to provide feedback to your performance so you can see what areas need improvement and what areas you are excelling in. If you're struggling with skills, visit the skills lab to practice. Set up a time with an instructor to review these skills to see what you may be lacking. Clinicals are a time for learning and improving. Feedback may be verbal or written on the evaluation form. Instructors will be providing areas needed for improvement, such as your sterile technique. They will also identify areas the students are excelling in, such as your patient communication. If you have questions about how you can improve, please speak with your instructor for clarification because they want you to learn from their comments. Clinical instructors, clinical site staff, and students will be collaborating and working together to provide care to these patients. It is important to communicate well with one another. Students will be assigned a patient and the primary nurse of that patient. The student nurse will work with the primary nurse as well as the instructor to perform tasks. Instructors will be communicating with staff when evaluating patients in order to determine how well you are performing. We will now discuss how evaluations will be fair. To provide fair evaluation process, instructors will utilize the predetermined competency forms. This includes the Clinical Evaluation Tool Level 1 Semester 1 form or the Crichton Competency Evaluation Instrument. These cover areas such as assessment, communication, clinical judgment, patient safety, and collaboration, as well as others. Students will have access to this form in order to prepare for what is expected of their clinical performance. This form has satisfactory, unsatisfactory, and needs improvement for the grading. But if a component on the form is not performed or there wasn't an opportunity for the skill to be performed, the evaluator will write not applicable so that it doesn't affect your score. Instructors will provide an unbiased perspective as well as feedback will be provided for reasoning of scoring. For these next two PowerPoint presentation slides, we will be discussing clinical evaluation and simulation evaluation. For clinical evaluation, there will be 9 clinical sites for each student in the hospital setting. The form used for the student to be evaluated will be the Clinical Evaluation Tool Level 1 Semester 1 form, and this is located under your clinical course in Canvas. There will be 6 students in each clinical group with 1 nursing instructor. Students will also be assigned a patient and the primary nurse for that patient as mentioned before. Students will be responsible for the medication administration, physical assessment, providing a bath, and repositioning patients. skills will also be performed but must be accompanied by the primary nurse or the nursing instructors. Skills are not to be performed without a licensed nurse present. We'll now discuss the simulation evaluation process. There will be 3 simulation clinicals in this semester, and they will be conducted at the school in the Sims lab. The Crichton Competency Evaluation Form is what will be utilized to evaluate your performance in the Sims lab. The simulation experience is an opportunity to practice your skills before progressing to real patient care settings. This is also an opportunity to provide safe environments to enhance learning and critical thinking for you as a student. Student conduct for simulation is the same as other clinical sites, such as your hospital setting clinical sites. You may refer to the guidelines for simulation experiences form. Simulation clinicals can also be difficult and they can be frightening for students to navigate, but it is important to come with an open mind and to prepare for simulations as you would other clinical sites. Alright, now overall, what is expected of the student? What, as an instructor, do I want to see in my nursing students? Be prepared. I want you to have all of your equipment. I want you to have all your text, all of your resources that you need to provide safe and effective care to your patients. Instructors want to see students who have prepared for clinicals well. Review your skills and ensure you have all your necessary materials needed for clinicals. And don't be afraid to ask questions. This is a learning process, and we want to know that you're learning as much as you can in these clinical settings. And journal. At the end of each clinical site, you will be journaling what you've learned, what you feel like you did well on, and areas that you feel like you can improve on. And be professional. You never know who is watching. You want to represent not only your community and your program well, but represent yourself well. These clinical sites may be a potential employer option in the future. And come prepared to learn. Don't be scared, be prepared. To conclude, I hope this presentation has answered many questions or concerns you may have, but if you have any more questions, feel free to reach out to me or your advisor via email or during their office hours. The clinical rotation schedule will be posted at the end of next week, and we look forward to having a great learning experience with you guys this semester. So thank you for your time.